Hi, in this video I'd like to talk about the question of ovulation problems. Are you facing ovulation problems, or you're not ovulating frequently, or in some cases there's no ovulation observed at all? What can be causing this? So ovulation means that the ovaries will be releasing egg cells to be fertilized every month during your menstrual cycle. So if you're healthy, you'll have a regular cycle of 28 days where the ovaries will be releasing these egg cells into the fallopian tube and hopefully to be fertilized into a pregnancy. Now, a lot of women, especially nowadays, they are facing problems where they don't ovulate. Sometimes they don't observe any menses, or the periods between the last cycle and current cycle is getting further and further apart. So what are some of the causes behind this, and what can you do to actually overcome them? So today we'd like to talk about 5 common causes. First cause is the most common cause that we see in our patients here at Antai Hospital, which is PCOS, Polycystic Ovarian Syndrome, which is a disease within the ovaries affecting the ovulation process. PCOS needs to be actually accurately diagnosed and treated, and we diagnose this condition using blood tests, looking at your physical symptoms, also checking your insulin levels, and also we will do some pelvic ultrasounds of the ovaries as well to actually accurately determine, because it is not so easily diagnosed. And treatment here at Antai Hospital is that we will be removing these abnormal tissues that are present inside the ovaries that is causing this PCOS. And on this cause, you need a doctor's help. You need to find treatment to actually overcome. Once this cause is treated, then you can actually begin ovulating normally and even seek pregnancy. Second cause is body weight. Body weight is something that you yourself can overcome. You do not need to actually come to a doctor. Body weight, what I mean is that patients who are severely underweight and patients who are severely overweight, this can actually affect your ovulation process. And what you can do is to actually get back to a healthy range of weight, body weight. For example, if you're underweight, then you need to begin to increase your calories, increase your food intake. And then if you're overweight, then you will need to actually begin to exercise, control your food intake. And then very quickly, once you see results, you can actually begin ovulation. You don't need to see a doctor or a hospital. These are some things that you can do yourself at home. Thirdly is excessive exercise. Excessive exercise is also a very common problem that we see in female athletes, especially those in their adolescent ages and in their 20s, where they are exercising on a daily basis, multiple times a day, and then they will also observe amenorrhea, which means no menses, no ovulation at all. And the solution for this is very simple, which is to cut down your exercise. So if you are somebody who exercises a lot and you feel like you are not ovulating, the cause is actually the exercise itself. You might want to reduce the frequency and then observe. Very quickly you will actually resume ovulation. And then the fourth cause is also a common one, which is a hormonal imbalance. We are looking at 3 common hormones, which is prolactin. If prolactin is too high, then there might be some problems inside them. You need medication and treatment. We don't want prolactin to be too high if you are not pregnant or not even in nursing stages. This is something that we can determine by using blood tests and then give you the appropriate medication. You will need to actually talk to your doctor for this cause. Next one is TSH, which is thyroid stimulating hormone, which is the hormone that is secreted to your thyroid. If you have hypothyroidism or hyperthyroidism, they can actually affect the ovulation process, and you will also need the blood test, and then also we will also give you some medication to actually bring back the balance. This is also needed to actually, you need a doctor to actually intervene to help you restore your ovulation. Now the final cause, which is a lesser common known cause, which is POI. POI is known as primary ovarian insufficiency or premature ovarian insufficiency, where the ovaries are actually failing prematurely at an early age, within the age of 26 to 40, where this period your ovaries should be actually at the peak level where they're actually secreting hormones and releasing follicles. But for POI patients, the ovaries are no longer secreting high levels of hormones and no longer releasing follicles because it's actually experiencing onset menopause. So for these types of conditions, you will need a doctor's help to actually accurately diagnose and receive treatment. Here at Antai Hospital, what we do for POI is that we will actually prescribe you certain birth control pills and contraceptives, specific medications to actually help to actually restore the ovulation process, because for POI, the ovary is actually in a state of fatigue, extreme fatigue, which is why it is not ovulating anymore. So with the help of birth control pills and contraceptives, the ovaries can actually take some time to actually recover, and within a period of 3 to 6 months you can actually observe ovulation to be restored. Antai Hospital actually offers treatment for PCOS, hormonal imbalance, and also POI for patients who are actually experiencing ovulation problems, especially those who are seeking pregnancy. You need to be accurately diagnosed and then receive the appropriate treatment. If you'd like to seek more information, or if you have more questions about ovulation problems, please leave me a comment down below. Do also visit our website, read our articles, and also arrange an online consultation.